So part 8, screening for testicular cancer. No, we're not great. There's no screening protocol at all. Testicular exam is part of a normal checkup. It's on a physical exam. If there's a mass, it's going to be relatively easy to see for the physician. And the survival data tells you that even if there's distant disease, our treatment methods are pretty effective. Or more specifically, it tells you that the tumor is pretty responsive to chemotherapy and radiation. So more than anything, it's not that we're great with screening or anything like that. We're just fortunate that this tumor responds to the treatments we have, and it's relatively easy to detect by physical exam. So the last one, cervical cancer. And I know at the beginning I said I was going to talk about this third, or I did in my slides, and I switched it because I wanted to end on something positive and more specific. I wanted to show how this has really been a public health success, and how what we're doing in the United States and really kind of the Western world, first world, is really set apart from what the rest of the world has to experience. Where progress has been made, and progress is probably going to continue to be made because of the HPV vaccine. So this isn't to say, yay us and, thumb our noses at anybody. It's really something to aspire to say, hey, we should be trying to do something to bring the rest of the world with us, because things could really be a lot better. So here we go. So risk factors. This is a cancer with a defined viral exposure, human papillomavirus. If a woman is exposed to human papillomavirus and it's only exposed through sexual contact, your chances of getting cervical cancer go way up. Other links are higher risk sexual behaviors, and by that it's meant either early age of onset of sexual activity, having multiple partners, or having a partner with multiple partners. And if you break it down, what it really comes down to is, what are your chances of HPV exposure? That's all it really comes down to. Smoking, and that was an odd one when I found it, but apparently there have been carcinogens from tobacco smoke that have been found in women's cervical mucus. So it's not just like a link with some cancers where it's like, oh, if you smoke, that maybe you're not taking care of other parts of your health. There's actually a potential cause and effect link here. And then chlamydial infections, where there seems to be some sort of link where having a chlamydial infection is beneficial to transmission of HPV and actually helps the virus take root. Other risk factors, long-term use of birth control pills. Though I didn't post it here, apparently there's some evidence showing that use of intrauterine devices to prevent pregnancy actually lower the risk of HPV. Having 3 or more full-term pregnancies increases your risk of HPV. And I noted that looking through some of the data that a lot of women in poorer countries are actually diagnosed with cervical cancer at times of delivery, of having a baby, which is just awful. Young age at first pregnancy is a risk factor. Low income status. And that's more of a issue of a barrier to the medical system in order to get screened or follow up to screening and just access to healthcare in general. And then this one just threw me for a loop. Low fiber, low fruit and vegetable diet. I'm sorry, guys. I'm usually pretty smart, but I can't explain that one. Signs and symptoms. Women will experience or can experience the following. Either abnormally long periods or abnormal vaginal bleeding when they have a period. And that's just due to the cancer being more what's called friable, or easier to traumatize and bleed itself. Pain during sex. Unusual vaginal discharge. And then once the cancer has left the cervix, sign of metastases. So problems with urination, change to bowel movements, that kind of stuff. And we'll pick up with part 9 in a second.